happening in our mind, it will manifest on our body, and whatever happening in our body, it will find expression on your mind. So everything is interrelated. That's what Ayurveda says. And in Ayurveda, and they say this Sandhigat Vat, or you also call it as osteoarthritis, it's a result of that. The specific word that's been used to describe this knee joint pain in Ayurveda, it is called Sandhigat Vat. So what is Sandhi means joint, and Gat means established in it, Vata means the Vata dosh that got disturbed in your this specific joint, that is called Sandhigat Vat, or you can also correlate it with osteoarthritis of modern disease. Now let's see where is the prevalence, in whom we feel there is more this osteoarthritis problems. Most of the times it happens the woman near menopausal age. So they suffer from this osteoarthritis too much. There is more prevalence of this osteoarthritis if the woman is near menopausal age. And many times it also happens in very obese patients, the people who have a lot of weight. So in Ayurveda, there are many things that you can do to combat this Vata dosha so that your knee joint health will become better. There are various procedures that we mentioned in Ayurveda to reduce this Vata dosh, because when Vata dosh will become balanced, your pain will subside naturally, because this pain is happening because of aggravated Vata, and it is disturbing the Pitta over there, also the Kapha dosh over there. It depends what kind of Prakriti a person have, what kind of his lifestyle is, what kind of his eating habits, work situation, many other factors come into play. So actual diagnosis of this can happen only if you want to know, if you want to have a Ayurveda diagnosis, definitely you need to take consultation from a Ayurveda doctor. Yourself, pain is happening, this dosha, this is happening, this dosha, the things are not like that. Definitely you have to take proper consultation from a Ayurveda doctor if you really want to know the Ayurveda perspective of your knee joint. So it is not, we never recommend, okay, self-diagnosis and self-treatment, we never promote it because it is all the time, it is not good for patient's health, because many times people think, okay, this is simple, I know this pain happening, Ayurveda says this, or we will eat this. So I would like to tell you, and I want to aware you, please don't do these things. If you really want some Ayurveda thing, you always go for proper prescription or consultation. Never try to have this self-medication. It is not always good, believe me. But there are some universal precautions which everybody can do even if he has pain in joint, and how to recognize whether he need to have consultation or not, or he has to go for orthopedic doctor's treatment or some Ayurveda doctor advice. So there are many things which you need to take care of. So today I am going to share those things which, if you are also feeling these kind of symptoms, so this is the high time that you pay attention towards your knee joint. So first we are going through the pain criteria. I will speak 5 points regarding pain for your joint. You see like whether your joint is going through these problems or not. So if you feel like, okay, there is some of the point your knee is having, some point is valid on your knee, you can always write down in the comment section below, like regarding pain, which point is valid to you. You can mention that point, like this is the thing which you are observing in your knee joint, and we will answer you whether your knee health is good or not good, or you need to go to some physician or not, because this is the main problem. If people are not aware of, if they get aware of how to take care of the knee health, then definitely they will take precautions and their disease will not progress. So these are the small points which I am going to tell you, and you observe whether these points are applicable on your knee joint or not. So first we are going to talk about the most important point, that is pain. every organ in our body catches our attention only when we have pain. It's true, right? So let's talk about pain. So first point is whether you have no pain, like you are not feeling any pain in the joint. So that is first point. Is it true? If yes, if no pain, you don't write anything. If there is pain, you please mention yes, there is a pain in your knee joint. Next point which you need to take care of is whether you feel pain when you have excessive movement of your knee joint. For example, you walked a lot, or if you did something in which includes a lot of knee joint movement, does it hurt? Does it cause pain? So this one is the second point. So third point is you feel pain even if you do little movement of knee joint. For example, if you very little movement of your knee joint happen and if you feel pain, this is our third point which you need to take care of. So fourth point is, let's suppose you are lying down on bed. You are in resting posture, whether sitting or bed, but you still feel mild pain in your knee joint. Is it the condition with you? Mention. And fifth point is, there is a continuous pain in your knee joint, whether you are sitting, standing, walking, everywhere you will having point. So this is the fifth point which you can mention. So these are the 5 pointers for pain. If you are feeling any these kind of symptoms, you can mention below in our comment section, or you can write personal message to us. Whatever you like, you can do. But you see, like, these points are applicable on your knee joint. So next thing which catches our attention about knee is swelling. Swelling, swollen, you understand? Swelling. So when knee joint looks normal, it doesn't catch attention. But once it gets swollen, sometimes you will see the knee joint gets swell. Suddenly, if any swelling comes on any body part, we feel like swelling happened. It catches our attention. So next point which I am going to mention for the health of your knee joint is watch swelling. So first pointer about swelling, I will again say these 5 points and you see which point is valid on you. First point is no swelling. Okay, no swelling is good. Second point is there is swelling, but you can observe it only after you pay attention on your knee. Otherwise it is no swelling on the knee. But if you pay proper attention on your knee, you see like there is a little bit of swelling. Check it. Third point is there is swelling which can be obviously observed. Even anybody can see that kind of swelling. So that kind of swelling is present on your knee.